So welcome everyone to today's webinar. My name's Jo Dempster and I'm the Global Safeguarding Lead for the Disability Inclusive Development Programme, which is part of Inclusive Futures. I've been working on the programme since it began in August 2018, which is almost, over 7 years now. And this session we're really excited about is to launch our learning product, which is, as you can see on the title, Practical Pathways for Disability Inclusive Safeguarding, which focuses really on translating all the learning that we've had through the programme into practical action. So really moving beyond theory to implementation. And it's such an important topic, and it's so great to see so many of you here today. So a little bit of housekeeping before we start. Today's webinar will be in English with simultaneous translations available for Bengali and Nepali. So to choose your language channel in Zoom, click the interpretation button, which you should be able to see in your Zoom window, and then click the language that you'd like to hear. And to hear the interpreted language only, click the mute original audio button. Closed captions will also be available during the webinar, and to review captions in Zoom, click the closed captions, the CC button, and then select show subtitles. We've also got Laura and Zhao providing international sign language throughout the webinar. Great. So we're going to record the webinar and we'll be able to share it afterwards. So you can watch it back or share it with colleagues. Please use the chat function to make any comments, and the QA box is open if you'd like to raise questions to our panel. We've received some questions in advance when people registered, and we're going to work through as many of those as we can following the panel discussion. So a little bit about what Inclusive Futures is. It's UKAID's flagship disability inclusion initiative, and it's led by Sightsavers and the International Disability Alliance, IDA. It's a consortium of 10 organisations. We had ADD, BRAC, BBC Media Action, Humanity Inclusion, IDA, IDS, Institution of Development Studies, Light for the World, Sense International, Sightsavers, and Social Development Direct. So across the 7 years, the program's worked across thematic areas of health, education, livelihoods, and targeting negative stereotyping and discrimination. And we work in Bangladesh, Nepal, Nigeria, Kenya, Tanzania, and Uganda. So at the beginning of the program, we set up a safeguarding approach. And this approach thought about safeguarding in terms of keeping people we work with safe from exploitation and abuse, as well as strengthening safeguarding culture. So we were really determined that it wasn't simply about compliance and risk management, but it was also looking at safeguarding culture and what that means in practice. So safeguarding's also becomes more important in challenging times that we're facing in the development sector at the moment. We're seeing safeguarding functions really erode and program functions, and we need to make sure, this learning piece will hopefully help organizations to make sure that safeguarding remains a priority in these uncertain times, because it's really about the integrity of our work and protecting the rights of those that we work with and for. We're really delighted to be launching this learning product today. I think we're going to include a link in the chat. So it's called Practical Pathways for Disability Inclusive Safeguarding, Lessons Learned from Inclusive Futures. And it really talks across 7 key learnings as kind of case studies. And each learning has an accompanying training scenario, and they're really designed to be practical tools that you can use as a whole collection, or if you're working on a particular piece of the guidance. So yeah, it's about practical implementation, not just policy. And our approach in developing this has been evidence-based learning developed with our participants and partners, including persons with disability themselves, organizations of people with disabilities, so we'll refer to them as OPDs throughout this webinar, local government, and real-world implementation experience across multiple countries and contexts. And it really focuses on what works and the reality of what doesn't and why. It addresses the resource realities organizations actually face when they're implementing safeguarding. And it takes significant time, the fact that it takes significant time, that funders often don't, it's the unseen costs, and we really try and cover that. And we'll, our speakers will be talking about that too. It takes us through the vital role played by OPD partners. We know that community members reach out to our OPD partners. They're the trusted people on the ground, and they may raise safeguarding concerns with them. And this creates opportunities for organizations to be able to respond, but it also does create real resource challenges. And hopefully the learning product explores these. And we know this matters because we know people with disabilities face disproportionate risks. Children with disabilities are almost 4 times more likely to experience violence than their peers. Women and girls with disabilities face higher risks of sexual violence and abuse. And we know that negative attitudes, inaccessible reporting structures, and lack of inclusive support services mean that people with disabilities are less likely to report abuse and therefore access any support services. So we have an excellent team of panelists representing different perspectives. So we've got frontline implementation expertise, we've got international organization perspective, and we've got donor program insights as well. So without further ado, I'm really delighted to hand over to Amber Sileclair, who is the Senior Manager for Programs and Impact at the International Disability Alliance, IDA. Amber brings extensive expertise in disability rights and inclusive programming, making her perfectly positioned to guide today's discussion on turning these lessons into real action. So welcome, Amber, and over to you.
Thank you very much, Joe, and thank you for all of the work that's gone into this amazing product. And thanks to all of you who've joined us today. I am dialing in from Bangkok, where it's a bit of a rainy evening, but we're really excited to be a part of this product, also mostly because it is an underrepresented issue. And when it comes to safeguarding, there's not a lot of thought put into what exactly disability inclusive safeguarding means, and really looking at empowering persons with disabilities to exercise safeguarding mechanisms rather than applying paternalistic approaches. And that's something that this toolkit does very well. At the outset, I will be taking you through the 7 pathways of the of this learning product. And our speakers will be going into a little more detail on some of the pathways. But here's just a little bit of a taster of what to expect in the overall in the overall product. So the first step is setting up a global safeguarding approach. This is really important because safeguarding is not a standalone issue. It is something that needs to be embedded throughout programming. How are we coordinating and communicating and identifying roles and responsibilities, for instance? The second is the need to collaborate with organizations of persons with disabilities and partner organizations. We cannot assess safeguarding risks in a vacuum. And the safeguarding risks that exist in any community are quite dependent on individual circumstances. And so it's really important to talk to trusted partners there. You need to work with organizations of persons with disabilities to learn more about the communities that you work in. But at the same time, we're asking, or this tool is asking you to work with organizations that are actually severely under-resourced and often do not have full capacities on safeguarding themselves. So part of this is really working with OPDs to support them on their own safeguarding capacity and recognizing their role as, the front line or the first point of contact for persons with disabilities in the community as well. The next is including the experience of women and girls with disabilities. As Joe mentioned, there is a huge impact of stereotypes, of stigma, and discrimination. And all of these actually amplify the risks that women and girls generally face when it comes to the risk of sexual violence or abuse. So for women and girls with disabilities, this increases simply because of the inaccessibility of any redressal mechanisms. There is experiences of women and girls with disabilities in accessing referral services. What are the barriers experienced? And there's a lot to learn from. So it's really important to include the experience of women and girls with disabilities in your safeguarding mechanisms. The next is building awareness about disability and safeguarding within the community, within the service providers, within other allies or other partners that you have in the course of a program. This is really important because in many contexts, persons with disabilities do not have access to justice or other mechanisms on an equal basis with others. So it's really important to get the community aware of what safeguarding is, what we mean by different aspects around safeguarding. And this will also imply that we address or we really think about accessibility and reasonable accommodation in providing these information, because often this could be something that's quite new to the communities that you work in. That takes us to the next, which is making reporting inclusive. There's no point of a safeguarding policy if the people who need it the most are not able to use it. Think about a telephone hotline and think about how accessible that is for deaf people. It's not, right? So you need to think about what works in a particular context and think about making sure that everybody who needs it can access it. So work with the communities, understand their needs, understand their experiences, understand the barriers. The next step is finding inclusive referral services. It's really important that when we refer people who have experienced safeguarding violations to referral services, that these need to be as accessible as possible. They should not perpetuate the experience or they not worsen the experience that you've already gone through. So it's really important to map inclusive referral services, research them, monitor them, work with them. And lastly, and perhaps it's something which goes through all of the points, is budgeting for a holistic, community-focused approach on safeguarding. It's really important that we think about training, we think about coordinating, reporting, and supporting people who need it, including through the provision of reasonable accommodation to access the entire gamut of safeguarding services that are available within a particular program. So again, these are very top level bullet points. I really encourage you to download the resource and read it. But in the meantime, I am going to take us through our panelists for today. We have a really great selection of panelists, and I'll be introducing each of them before they come to speak. And so without any further delay, I'm going to start the session with Ishrat Rupa, who is the Advocacy Officer for the National Resource Center on Deaf Blindness, and she's joining us from Bangladesh. So I'm going to hand over the floor to Ishrat. Thank you for joining us. And all speakers have about 5 minutes. So it's really a challenge, but over to you. Thank you.
Thanks, Amba, and good morning and good afternoon to everyone who is listening to us. I hope I'm audible. Yeah. My name is Ishrat Jahan Rupa, and I'm working as an advocacy officer for the Center for Disability in Development (CDD), which is a national level NGO and works across the country. And I'm based in Dhaka. I particularly work for mainstreaming deafblindness and multiple disabilities and their families into development. So as an additional responsibility, I also assist our safeguarding focal in terms of training, awareness raising, and system strengthening. Also, in the Disability Inclusive Development Task Order 45 project, I am the safeguarding focal for the home-based education intervention. To start with the designing and implementation of safeguarding approaches in our organization. So CDD is an organization where inclusive safeguarding is not just an add-on; it's an embedded. It's actually embedded in culture and practice, which is reflected in CDD's values, which includes respect all human diversity, taking the side of most vulnerable, and promote respect and diversity. And towards safeguarding, our approach is do no harm, and to any kind of safeguarding incident, zero tolerance approach. So whenever designing and concept planning for any program or policies, CDD follows a very consultative and participatory approach. For example, in terms of policy review, like in 2024, we have reviewed all of our safeguarding policies and safeguarding strategy, where we had the chances to consult with different level of stakeholders, which includes male and female with disabilities separate in separate group, the project participants, especially adolescent girls with disabilities, self-help groups, youth with deaf blindness, children and their caregivers. Through the consultative approach, we have come up with the proactive and reactive channels for reporting or responding to any kind of safeguarding concerns. Our basic safeguarding proactive channels, reporting channels included a designated safeguarding focal person, dedicated phone numbers, email, and transparent and safe compliant box. We also have incorporated sign language to address the needs of deaf people, and also braille for visually impaired people. There are options for verbal or face-to-face raising concern, and also whistleblowing and written template is also there. In terms of proactive mechanisms, so we have an IFRM officer, which is Inclusive Feedback and Response Mechanism Officer. This position is particularly for emergency humanitarian response context. On the other hand, in terms of other development projects, including the home-based education project, observation and key question to open up discussion with while field visit is a very common practice. And also there are posters which especially with mentioning the reporting channels, basic code of conduct, and displaying focal person's number and adhering to other hotlines especially. Also there are training sessions, awareness session, and especially to work with children with multiple and severe disabilities. We include safeguarding issues in individualized education plan, like awareing them on good touch and bad touch, and then also sexual rights, sexual and reproductive health rights. So we do consider those as well. And also in terms of physical accessibility, like in all of our offices and also in partner organizations offices, we have placed compliant box in an accessible place, so that people with disabilities or any kind of having any kind of physical impairments, they can easily access the place and compliant box and can place their complaint. Also, as a proactive measure, we try to build rapport with the family, and we try to work very closely with the family so that they can open up the conversation to share any kind of issues they're facing from our services, during our services, or any of the well. I'd like to mention some of the practices from our home-based education. especially while we were designing the home-based education project in terms of all capacity development initiative. Safeguarding was mandatory for every session, every training for any kind of stakeholders. We have developed a risk register for home-based education intervention where safeguarding has a special attention. And we have incorporated OPD volunteers from the communities, especially from the identification and for the identification and outreach, because they are the community people. They know where the children with disabilities are residing. And also when we are going with the community people, the OPDs, the families feel safe and they are being assured that these people are not going to cause any harm because we have our own people with them. And
Thank you. Sorry, so we're running a little over time, but I'm
just,
pretty sure that there will be questions for that. Would you like to just have a concluding statement? Thank you.
yeah, thank you. So actually, whenever we are planning and designing any of the activities, we believe that the slogan we always utter that nothing about us without us.
Sure.
So
Okay.
in terms of, yeah, in terms of safeguarding, we practice that in every aspects of support and services we are providing. So, thank you.
Thank you very much. Thank you very much for your intervention on how designing and adapting safeguarding policies and the specific considerations we build in to make sure that accessible mechanisms work for all of the different kinds of people with disabilities that you work with and different contexts. I'm now going to pass to Neeraj Giri from the National Federation of the Deaf Nepal. So this is an organization of persons with disabilities. Neeraj, how do you challenge existing attitudes and build awareness about disability and safeguarding risks within your teams and the communities that you work with?
Yeah, am I audible? Yeah. Thank you very much for this wonderful opportunity, and thank you for the question. When we talk about changing the attitudes and building awareness, it's always important to start by understanding why these kinds of attitudes exist in the first place. Many misconceptions about disability come from a mix of social, cultural, and economic factors. So, challenging attitude is not only about giving messages, it's also about addressing the environment and realities that shapes those beliefs. That's why NDFN always focus morely on the home-based support in terms of children with complex disabilities. We visiting those families allows us to understand their everyday situation, how they are struggling, and their hopes and the family dynamics. It also allows us to build trust, which is the first steps to the meaningful change. Here, I like to share one case while we are working. So before our intervention in the home-based support, one of our beneficiaries was kept in the cow shed. When we firstly visited the family to introduce home-based service, they were completely negative and unwilling to cooperate for our support. Instead of giving up, we continued our engagement in close coordination with community representatives, OPDs, local leaders, and ward officials. Through regular visits and showing them about our work and the positive changes what we have done, they were slowly started to become positive and we succeeded to gain the trust. Together with the family, then we developed the individualized education plans, nutritional support plans, and we started to work through that. We also worked on the reasonable accommodation, and eventually the family brought the child inside the home. That was a powerful moment that reflected a complete shift in the mindset and attitude. Later, during our regular frequent visits, we also found that the family was become the victim of fraudulent that some individual promised them to cure the disability of the child in exchange of money. This experience helped us to strengthen our orientation and safeguarding sessions while family raising about the raising awareness about such cases and helping them recognize and report the risks. That's how safeguarding becomes real, by linking it to lived experience. Nextly, we also hold regular discussion on safeguarding both within our team and families to keep them concept alive in practice, not just on paper. And we always try to keep the family at the center. Even a short informal orientation makes a big difference in helping family recognize risks and know how to respond when something doesn't feel right. Another key part is working with organization of person with disabilities. They are essential partner for challenging stigmas and harmful practices, because it creates authentic impact and shifts perception more effectively when person with disability themselves speaks. Beyond that, we also believe in strong coordination with local governments, schools, parents, communities, promoting shared responsibility of safeguarding and inclusion. Within our organization, we also invest in capacity building through regular training, refreshers, and open discussion on real life challenges faced by our team members. Another practical approach, we we are developing information and communication materials in multiple accessible formats like print, visual, sign language, videos, brailles, and audios. It's all about meeting people where they are, using tools, contents, and language that fits their needs and realities. That's how inclusion becomes real, not just theoretical. We also promote Parents Network for peer counseling and advocacy. We partners with local leaders, teachers, health workers to help sustain awareness at community level. When this actor takes the ownership, change become more lasting. Concluding my words, change is not one-time activity. It's a process. So we continuously monitor and reflect on our own attitudes and practices as a team. Creating a safe internal space for reflection helps us accountable, learn from mistakes, and ensure the safeguarding is truly inclusive and respectful for everyone's dignity, so that we can challenge these kinds of attitudes and build awareness about disability and safeguarding risks. Thank you. Thank you very much.
Thank you, Neeraj, and thank you for really sticking to the 5-minute mark. It's a really great account of the kind of role that OPDs play in communities and the kind of issues that come up. It's not just looking at the traditional kind of gamut of cases we think about when we think about safeguarding with persons with disabilities in the community. There are many, many situations to be responsive towards. And it's a great set of examples, and such powerful examples as well. Thank you very much. It is now my pleasure to invite Annie Hans. Annie is the Disability Inclusive Development Coordinator for Humanity and Inclusion UK. Annie, the floor is yours, and to talk to us about the reality of OPDs, which have fewer resources than international organizations. How do we ensure sustainability and realistic context, especially when a lot of things are quite time sensitive and there are quite a few milestones to meet as well. Annie, over to you.
Thank you, Amber. Thank you for the question. And just to bring a bit of context, so the Inclusive Futures Consortium works with over 200 OPDs across 6 countries in Africa and Asia. In Nepal alone, we work with about 59 OPDs. Some are large umbrella organizations and some are small, like informal groups that have been brought together by a shared agenda. So you can well imagine that there is a wide diversity in terms of structure and capacity across OPDs. Some OPDs would have like an organizational policy including safeguarding, while other organizations will just have like a bylaw, and volunteer groups may not have any written guideline at all. So for many OPDs and their members, the concept of safeguarding was relatively new when we started out. And introducing and embedding safeguarding, it takes time, and it must be adapted to each organization's context. So across our projects, what we tried to do was we tried to introduce safeguarding into all our activities with OPDs. So whether it was planning or meetings or budgeting or training, so that OPDs would gradually become familiar with the language of safeguarding. So we explain what it means, why it matters, and how it connects to their daily work. We also had like regular dialogues with OPD members around questions like what makes you feel safe or unsafe? And we co-developed accessible reporting mechanisms where applicable. We looked at risk assessments together. We co-designed risk mitigation strategies. Often these were done in very informal and accessible ways. We also provided technical mentoring to the OPD staff and psychosocial support to OPD staff as per need when they were doing case management. An important factor that I want to bring to highlight out here is that OPDs, because of the deep roots in community, are often trusted more than like an INGO would be or a national organization. They have like a very strong connect and trust of families and people with disabilities. And they often know exactly what's happening on the ground, which family has a child with disability, who's going to school, who's being excluded, who's at risk of abuse. And because of these close connections, OPDs are often called upon also to support survivors. But while OPDs are best placed to understand the local risk and support reporting and case management, they rarely have the same resources, training, and personnel as a large international organization would. So the challenge we found is that OPDs often spend most of the time on practical implementation, like accompanying a survivor to a police station or to a crisis center, raising an alert, discussing the incident with the school committee, or even mediating family disputes, all while managing their own safety. And we also need to understand the human side of safeguarding. Because due to OPD standing in the community, the level of trust individuals would usually disclose abuse that even sits outside the scope of an organizational safeguarding policy. Like, for example, what I mean is it's not abuse that has happened as a result of a program activity or the behavior of a staff. Rather, it's a concern that we would classify as a community concern, something that's happened outside of the program but has been reported to the OPD. And as human beings, there is a moral and ethical duty to do something about it. So effective safeguarding depends on participatory risk assessment, supportive partnerships, and OPDs as partners bring lived experience and community trust, but accountability must be shared. And we also need to be honest about costs. Disability inclusive safeguarding, as you've already said, involves real costs. Costs like for training, for reporting systems, for accessible reporting system, for survivor support, for staff time and staff counseling and reflective supervision, also for OPD staff. And too often these are not budgeted. So within the Inclusive Futures program, we made it a requirement to include safeguarding costs project. And for example, about percent of the education for safeguarding activities. Safeguarding is about trust and shared accountability. To make it sustainable, we must work with OPDs, adapting to their context, valuing their strengths, and ensuring resources match responsibilities. And with this, I'd like to hand it back to you, Amba. Thank you so much for the question.
Thank you so much, Annie, for your explanation. Indeed, it is a disproportionate issue when you say that OPDs are doing so much with the limited resources. And it's a really important reflection to have, and it's really great to have partners like HI who are cognizant of these realities and actually are supporting OPDs around addressing them. I think that's a really great segue to our next speaker, who is Lucy Murage. Now, Lucy joins us from Light for the World Kenya, where she is head of programs. And Lucy is going to speak a little bit, or I'm asking Lucy to speak a little bit about how, since the learning piece talks about collaboration between OPDs and larger organizations, we'd actually like to understand about how the partnership approach has strengthened safeguarding in your own organization. But thank you very much for joining us. So I'm handing over to you for your 5 minutes. Thanks. Lucy, I think there's a bit of a issue with the connection. Do you want to try putting the video off and seeing if that helps, the audio?
All right. Thank you, Amber, and
Okay,
greetings all from Kenya. Yes. All right. Yes. Is that better?
Yes.
Is that better,
Yes.
Amber?
Yes. There's a bit of a lag, but it's fine. Thank you.
I want to talk about the OPD collaboration. As Light for the World, we worked very closely with the OPD, and in terms of having a very successful safeguarding approach to our program participants, is that working through the OPDs accessibility gaps when it
Lucy,
comes to safeguarding mechanisms. This is
Lucy,
because
Lucy, I'm really sorry. There's a bit of a lag. So there are breaks in between your while you're speaking. Is it possible that you can move to maybe another space where, or maybe just switch the connection? In the meantime,
sure.
don't worry, we'll go to the next speaker and I'll come back to you after that, okay? Okay, so with that, and thanks for the flexibility there. I'm going to pass to Emma Hagerman. So Emma is going to Emma joins us from Social Development Direct. And to Emma, my question is that since DID was FCDO's flagship disability inclusive development program, can you share your thoughts on the importance of working as a consortium partnership to deliver this and the kind of role that the SDD Help Desk played in this as well? So over to you for your 5 minutes. Thanks.
Brilliant. Thank you, Amber. Good morning, good evening. As Amber said, I'm the head of the Governance and Inclusive Societies portfolio here at Social Development Direct in the UK, but I'm also the strategic lead for the Disability Inclusion Help Desk, which is part of the Inclusive Futures programme. So we've been part of the programme pretty much since the start. So yeah, as Joe said, it reminded me it has been 7 years since 2018. So we designed and managed the help desk that supports the generation of a rigorous evidence base on what works to deliver results for people with disabilities. So the service is accessible for people across UK government, providing technical and training support to ensure that data and evidence is used to drive further action and investment in disability inclusion. At SD Direct, we manage actually quite a few help desks now, I think 6 or 7, many of which are SCDOs. But this help desk is extremely valuable and efficient and effective for numerous reasons. One is that it's connected to a program, the Inclusive Futures program, and it means we're able to work with a diversity of programs and the OPDs that are engaged. As was said earlier, 200 OPDs in the program. And so we are a platform to gather evidence around what works and to amplify that learning to others through the help desk and on our social networks and various networks with FCDO and others. Some people might know, but SD Direct, in collaboration with Plan International, developed a set of practical tools on how to build more equitable, inclusive partnerships. We have a toolkit and approach that was launched a few years ago. And this approach helps us to set a clear level of ambition for a program and for the partnerships in which operate within that, including added value through joint learning, knowledge sharing, and innovation. And we've applied this approach to our work in the help desk and with Inclusive Futures. So the learning here is that while working in a consortium partnership has advantages, The added strength that we have found of working with Inclusive Futures and with the consortium has been its highly collaborative nature and a commitment across the partners onto equity, learning, sharing a good practice, and building the evidence base for disability inclusion, including disability inclusive safeguarding. And this is critical to encourage other organizations and actors to take up the good practice in disability inclusive safeguarding. So there's a lot that can be learnt from this program, and the help desk has been central to drive that learning and evidence. And I think there's one kind of example that I wanted to highlight is a piece of work that we've just also just launched that complements the Inclusive Futures piece. Is we developed a disability inclusive safeguarding guidance notes that sets out some really practical steps on how to consider disability inclusion in safeguarding at each stage of this program cycle. And I believe it will be popped in the chat now for those that are interested to take a look. So we did this by reflecting on our own institutional learning at SD Direct, but also reviewing several external documents to map out what this looks like and should look like. But what was really critical is that we needed to bring life to the document, and we know that people learn by seeing what has worked in practice, including these really real life case studies. And so we worked with Inclusive Futures program to pull out some of the case studies around how they've integrated disability inclusion and safeguarding for each phase of the program cycle. So we spoke to many of the partners and pulled out some of those case studies, and those are peppered in the guidance note for the different areas of the program cycle. So I think these case studies have really strengthened the guidance note. It's also a really strong opportunity to highlight the good work that Inclusive Futures has delivered. So I think that is the critical part. It's bringing the help desk capacity to harvest learning evidence from others, but also then bringing it together with what is being delivered through the Inclusive Futures program. And we do that by presenting this learning and evidence digest, knowledge products, training materials, guidance notes like the one I've just discussed. And we always reach out to the consortium and the partners to ask what we should include in those resources or the content, and who we should talk to, particularly which organizations of persons with disabilities. So just to end, I'd say there's a lot of rich learning from the program, some of which has been shared today. We are now moving forward with the remaining few months of the program and the help desk. And we're going to do our best as the help desk to support the program to document this learning so that it can be shared with others. And that's part of what we're doing here today. So thank you so much, Amber, for having us. And I think the link is in the chat, so please take a look and reach out to us if needed. Thank you.
Yes. Thank you so much, Emma, for enriching this body of work. I'm now going to just check if Lucy has joined back and if we have a
Hi, Abba, can you hear me?
Yes, we can hear you. Yes. Please go ahead.
Yes, I'll avoid to put my video on.
It's okay. We'll miss you, but go on. It's fine. Thanks.
All right. Yeah, so I wanted to share our experience in Kenya, collaborating with OPDs. And this has been very key, and especially while identifying the accessibility gaps in the safeguarding mechanisms that we are currently operating here in Kenya. This is because the OPDs interact more. The OPD and the persons with disabilities, they also share more. So working with them, really, they supported us to identify the accessibility gaps in the current safeguarding mechanisms. Again, OPDs has been very crucial when it comes to advising on reasonable accommodation needs. This is again because they interact with them on a day-to-day. They understand their reasonable accommodation needs, and we all know that a successful safeguarding approach should provide reasonable accommodation to make sure that persons with disabilities are able to access the processes that are put in place. Then, of course, working with OPDs, we were able to establish more inclusive and accessible channels. So we co-created our community response and feedback mechanisms with OPDs, and they were able to give us the most accessible channels of reporting that are acceptable and easy to use by the communities that we serve. And these channels included like reporting through the OPD leaders, because this one, they have really gained trust, phone calls, and sending messages. So these are some of the channels that we see our program participants using them to report, and we co-created this with the organizations of persons with disabilities. And again, through engaging OPDs, it also increased the confidence of our program participants in reporting. And as a result, we have seen persons with disabilities reporting. And unlike before, when we were starting our Inclusive Futures program here in Kenya with our consortium partners, where persons with disabilities were not reporting. So we have seen that confidence going up as a result of working closely with OPDs. Then, of course, working with OPDs has really ensured that our safeguarding and response feedback are very, very respectful and adapted to fit the different needs of the society. And apart from working with OPDs, we also joined organizations and institutions that are within the protection and gender working groups here in Kenya, because they have formed structures, they have resources. So we joined them and designed accessible referral pathway. And this is one of the learning that Amber, you mentioned, that we might have very beautiful referral pathways, but they are not accessible to persons with disabilities. So working together with the gender and protection working groups here in Kenya, we designed accessible referral pathways where persons with disabilities are able to be referred and get services. We also supported them to come up with inclusive risk assessments, because we have risks that are really affecting persons with disabilities and were not foreseen by the gender and protection working groups. So having a very inclusive one really gives us the picture of what is happening to persons with disabilities. Again, we see a lot of case management tools and protocols within the gender working group, but they might be necessarily not inclusive. So working together, we have made the management tools very inclusive to address the needs of persons with disabilities, including the protocols. Things like data reported, how to capture data, how to ask questions and involve persons with disabilities. And again, we have been conducting joint capacity building to our program participants, because in our programs here in Kenya, we must train program participants on safeguarding at the beginning of any program, so that they will understand what is it, how to report, where to report. So we have worked together with the protection and gender working groups to come up with a joint capacity building that has been seen of very good quality. So, and also because of our expertise, what we have also learned is that most of these institutions may not understand the disability inclusion. So it is our mandate to support them with the disability inclusion journey, so that they are able to understand how to engage persons with disabilities when they come to report, when they need support, when they need feedback. So what we have done at Light for the World and our partners is to take them through the disability inclusion journey, so that they're able to work with persons with disabilities and protect them. So as I conclude, my conclusion is, it is only by working together, all of us together, can build safeguarding systems that are truly accessible, accountable, and effective in preventing harm and promoting the safety of well-being well-being of persons with disabilities. And again, inclusion is not an optional. It is a fundamental part of doing protection right. Thank you, and back to you,
Thank
Amber.
you. Thank you very much, Lucy, and I'm so glad that you could join us. We don't have a lot of time for questions. Many thanks to those of you who put questions in the Q&A box. We have, as Joe mentioned at the beginning, some people had questions for us, and we're going to prioritize those people who gave us questions during the registration. So the first question is specifically on children with complex disabilities, and how we can ensure disability inclusive safeguarding, especially for children with complex disabilities. Neeraj touched on this in his opening, so I'm going to pass it back for a little bit of elaboration. Neeraj, 2 minutes if that works for you. Thanks.
Yeah, thank you very much again. So, talking about disability inclusive safeguarding, it is quite difficult what works for one individual and what works for another individual. So every child is different and they have their own strengths, communication styles, and support they needs. So I think our approach must be very personalized, flexible, and built on understanding. Working on NFDN, we follow the approach similar to the individualized education plan, where every child have their own individualized plans for their learnings, where we assess each child's situation and plan support around their unique needs, mainly to make them to know about safeguarding. This helps us to know challenges as well as potential in every child. Nextly, we work on the communication part, as communication plays very important role uh, in context of children with complex disability, as always they may not be expressed verbally. So we use multiple modes of communications, signs, colors, gestures, symbols, and sometimes even emotional cues. We make learning about safeguarding playful and interactive, so child feels comfortable and can understand easily. I'm sharing this all based on the work we have done during our home-based support, working with Inclusive Futures. So I like to share here one example. So during our home-based sessions with the children, we use different simple signs for right and wrongs, colors like green for safe and red for risk, and different emojis like for knowing about their feelings like happiness or sadness. And this small tool helps us to know about how the child is feeling, whether they are comfortable or not, what their moods are, and are they scared or not. Another thing, for children who have speech difficulties, we also use the sign language options as well. In this all process, parents and caretakers are not just supporters, they are also the active participants while we work with the children. Their continuous presence and participation makes safeguarding more consistent, both at home and in the community. We also promote two adult policy, which ensures that no child is left ever alone with a single staff members while working with them. We also focus, as I shared previously, we also focused on different types of accessible materials based on the need of the children and the parents as well. And we also provide safe and confidential complaining channels and different formats so children and parents can communicate concerns in the way that suits them.
Okay.
Finally, I'll conclude with that we also maintain strong coordination with organizations of persons with disabilities, schools, health workers, and different authorities. At the end, inclusive safeguarding means ensuring that no child is left unheard or unseen, no matter how complex their disability might be. Thank you very much.
Thank you very much, Neeraj, for that. Thank you very much for giving us really practical examples. I'm going to squeeze in one more question, which is also about children, but it's really looking at how we reached vulnerable children in very remote areas. And I just want to see if, so it's really looking at where location is. And I want to see among the panelists, you could put your camera on if you can respond to this. Annie, the floor is yours. Thank you.
Thanks, Amber. So it's a very good question and a very difficult and challenging question. It's definitely a challenge reaching out to the remote areas. So, and I'll speak from our experience of working in the remote areas from quite inaccessible mountainous regions of Nepal. And again, we work on inclusive education in this region. So where little children are literally walking maybe 2 hours sometimes to attend primary school, and like basic facilities like there's no water, health facilities are inaccessible and far away. So ensuring safeguarding here is well implemented is a huge challenge, and especially in the context of poverty. So how we approached it is by two things, sorry. And this is to make information on safeguarding more available and accessible. So we use multiple formats, and my colleagues have already talked about those different formats. But basically, to repeat some of them, we would use like radio messages, school assemblies, community theater, posters, storytelling, community gathering, and a whole lot depended on our frontline staff who would work on a one-on-one with families. And just Niroj has already spoken about the individualized support that they received. So having those posters and working with the in the homes itself of each of these children, so that they knew what safeguarding means and where to go if they needed support. The second aspect to look at is the reporting and the referral services in the remote setting. And it was not realistic to expect families to travel long distances to report a case. So we looked at simpler ways. Okay, can we look at like the project team supporting the reporting? Can we look at school teachers supporting the reporting and referral, linking with community structures? So the basic focus was how do we link with community structures such as women-led self-help groups or a health worker or an OPD if it existed or a child protection committee if it was available. We had like a telephone free toll booth for phone calls, text messages, but the challenge still remains. So in the long run, I think what really makes a difference is finding community-based ways to prevent harm to people with disabilities, tackling disability stigma, and making sure people with disabilities are actively involved in these efforts.
Thank you very much. Thank you very much, Annie. And we're just at the hour now. I want to appreciate all of our panelists for really their very concise interventions. And I also want to, again, encourage all of you to look at the chat box for links to the product or on the Inclusive Futures website. Also look at the other products, including on participation of organizations of women with disabilities in programming and the 6 principles, because they're all very complementary and you can learn a lot from each of these products. So with that, I'm going to close today's webinar with a huge thanks to the team at MYT, also the team at Sightsavers that put this together, our service providers, captioners, and sign interpreters, our panelists once again. And of course, all of you for joining us. This will be available online as well for you guys to also download and, sort of consume on your own time. So many thanks for everyone who's made this event possible and for the authors of this really amazing toolkit. Thank you very much and have a great day.
To learn more, visit www.inclusivefutures.org/disability-inclusive-practices.